And I must say it's great to be here today to sort of give you what I would describe as a broad retrospective of our anchor organisation, community wealth building work here in County Durham. And before I start, I'm going to caveat this heavily, is that we haven't cracked it yet. We're still very much on our journey. And what I'm hoping that if nothing else today, you learn something from our experiences, and that it can either help or inform you as you either start your own work or continue your work on developing these anchor organisations or CWB initiatives in your area. And just a little bit about County Durham to start. We are a county of about 860 square miles. We've got a population of around 530,000 people living in around 234,000 households. We have about 260,000 people in our population who are economically active and around about 75,000 who are economically inactive, with around about 10,000, but don't quote me on this, unemployed at the moment. And when I talk about our anchor organisations, we have Durham County Council, who I represent. We have two trusts, County Durham and Darlington NHS Foundation Trust, and our Tees Escombe Wear Valley Mental Health Trust. We have a world-class university and Durham University. We have our police service, fire service, several further education providers. So it gives you an idea of the scale that we're working with here in County Durham. And I'll start by saying that community wealth building is one of our approaches to local economic development, which not only aims to redirect wealth back into our local economies, but also to increase wider economic inclusion, which is why public health takes such a lead role in this, because we recognise the positive impact that this can have upon local health and well-being. We recognise the interdependency between better health so that people can gain and sustain employment, and good regular income that can be spent by people on, for example, health promoting assets such as good quality homes, nutritious food, etc. So in County Durham, we are focusing on two pillars of community wealth building, which is fair employment and just labour markets, and also progressive procurement of goods and services. So a little bit about the background and the genesis of this work, and it really lies with our inclusive economic strategy, which was published 2 years ago. We have a County Durham Vision 2035, which was developed with our partner organisations and the public. It sets out what we want to look like by 2035, and one of its key ambitions is that we have more and better jobs in an inclusive green economy, amongst a range of other strategic objectives. That inclusive economic strategy that you can see here seeks to improve the quality of jobs so that wages are higher and we have fewer families living in poverty. So whilst we are seeking to create more and better jobs, a key focus of this is the inclusive nature. We want to ensure that the benefits of growth are shared fairly, and fairly is a really important word to us here in public health, as you will know. And we want to know that the benefits of any economic growth are shared amongst our people and places without exception. And this really includes those who continually face enduring barriers to good quality employment, and we want to see this integration of social and economic policy, which is why we are working together, public health, with our colleagues in regeneration, economy and growth to develop these infrastructures here in County Durham. Why do we do this? Well, we recognise in public health in particular that some people face long-term and, in County Durham, intergenerational barriers to employment. It results in deprivation, it results in significant inequality. And we see this predominantly in the north and east of our county, where almost 1 in 4 jobs earn below the real living wage. And we have approximately 21% of households across the county that live in relative poverty before housing costs. We have high levels of deprivation up here in the north in County Durham, with 12% of neighbourhoods in the 10% most deprived within the country. So whilst our strategy objectives will be addressed through a comprehensive delivery plan, the people element of this plan focuses on supporting people in education, training, jobs, and good employment, etc., by improving skill levels, addressing barriers to rewarding and productive employment, with this additional focus on health and well-being. So within that delivery plan, we have specific actions that relate directly to community wealth building and anchor organisations that will be crucial to the delivery of those actions. So we have three key approaches. We have a community wealth building approach for employment, which explores opportunities to increase economic inclusion and employment opportunities amongst left behind neighbourhoods. And that was the initial focus of our work. We have created steering groups and working groups with our human resources teams, with our two foundation trusts, and we're currently in discussion with our university and VCS organisations to work together to increase these opportunities in areas where the need is most prevalent. We have our own HR team working on programs such as a pre-employment program that will attract more people into good quality jobs with the local authority, for example. We are working against sort of evidence-based successful programs from other parts of the country, such as Leeds and South Tees, where we have seen really low attrition rates in these types of programs and really high success rates in respect of retention. We are fortunate enough in County Durham to be building a new hospital, which is in the Shotley Bridge area, and we are building a new leisure centre. We are using these as community wealth building demonstrator sites, and we're going to sort of commit to local procurement in respect of those. In fact, indeed, we have done so, and to seek to employ as many local people as possible on the under our fair employment pillar of our community wealth building approach. And as you referred to earlier, Julia, the County Durham Pound is a really well-established, award-winning network, which is formed amongst around, I think it's about 12 County Durham organisations who pledge to spend more money in the local economy. How long do I have left, Julia, by the way?
I would say if you are able to summarise in 30 seconds what you think are the key points you want to land with people, that would be amazing.
Great, thank you. So my advice as follows is that you build a guiding collaboration with those who you seek to work with when creating any anchor or community wealth building strategy. Look at your existing policies, plans. Do they refer to or align to anchor principles? For example, I've given you our local inclusive economic strategy, which is directly aligned to that. Make sure you gather the data. This is really important in respect of identifying need on a basis of proportionate universalism and informing your priorities. There will be lots of anchor activity in your area. I think it's important to scope that. And while scoping that, also identify leadership, because what we have found, one of the key issues is governance and reporting. So whilst we're doing a lot of work, we actually have still to address the more strategic elements of how we govern this. Identify, purpose, and agree strategic objectives. And for example, we are looking at best practice, shared learning, increased collaboration, sharing our resources, but not only locally, but regionally with the newly created North East Combined Authority and our regional healthcare partners. And once you're able to do that, I think it's about agreeing those anchor priorities so that there's no duplication of work and that so everyone's aligned in respect of your local and regional objectives.